Welcome to the CT BizCast. I'm your host, Ali Warshavsky, and today on our podcast, we are talking about a special partnership between Downs Construction Company and the Hospital for Special Care. We have Tom Romagnoli here from Downs with us today. We also have Lynn, Ricci, and Jeff Lawton from the Hospital of Special Care to discuss how they were able to build and renovate a partial hospital unit for kids with autism. The new inpatient building, which the partial hospital program is a part of, is one of 11 in the country. Jeff, Tom, and Lynn, welcome to the podcast.
Thank you.
Thank you.
Thanks for having us.
Tom, how large is Downs Construction and how long have you been established in Connecticut?
Downs Construction has been was established in Connecticut in 1934. So we've been around for 87 years. We're going on our 87th year. We're in our third generation of ownership. Annually, we do about $200 million worth of work. One of our primary focuses is on healthcare and our partnership with the Hospital for Special Care.
And do you have two locations, just one in Connecticut?
Yeah, we're home based out of New Britain for a long period of time. In the early stages of the company, primarily there was enough work to sustain our company in New Britain. And for a long time, our company thought it was far to travel outside of the New Britain, Hartford area, but we have since grown a little bit, and we do have an office in Rhode Island. We're pursuing work, and we've secured some work with the Providence School and Newport School districts.
Well, that's great. Now, in 2019, you were approached with a special project by Lynn to help expand the Hospital for Special Care. Lynn, tell us the work the hospital does with kids with autism and what you needed to reach out to Downs for to help you with.
So the hospital has been involved in working with children and their families with autism since 2010, when we responded to a significant need in the community. So our program grew from being just an outpatient program. In 2010, we opened an inpatient unit in 2015 and have continuously added beds to that unit based on the demand. What we have done recently is to open up an additional level of care. When we built our new building, it is 12 private rooms, really very specific space for this population. And we added a partial hospital program, which is a level of care that is toggles between being an inpatient unit and also an outpatient program. So it's very intensive. Kids come for several hours a day, receive the support that they need to be safe, and then they're able to go home to their families at night.
So explain to me, is that the part of it that makes it unique and one of 11 in the country, the inpatient, outpatient portion?
Well, interestingly, we were just recognized by Stanford University's Research Center as one of the top 4 programs for autism in the country. They actually reviewed 90 programs across the country. And I think what makes us unique is, one, yes, that broad continuum that we provide and the coordination of care. These are really complex kids that need to have a lot of tangents in their life that need to be brought together. But what makes us unique is that we have a dedicated specific unit for kids who have autism spectrum disorder. So we are not a psychiatric hospital. We're a chronic disease hospital, and we treat kids for their behavioral disturbance and work with their families to help them return home safely. And 99% of our kids go back home to their families successfully.
Now, you said there's a pretty high demand for the hospital, right? There's a waiting list for people to have treatment?
That's correct. So we currently have 12 available beds with an average length of stay of about 25 days. And we have a waiting list that averages between 15 and 25 kids per day on the list to come into one of the very few beds that would open with a discharge.
Wow. So a very high demand time for you guys and big need that you're adding to the community. Now, Jeff or Tom, what types of adjustments did you have to make to make sure it worked for kids with sensory issues and other special needs?
So the architect worked pretty hard on making sure that this was all in place. It's not like you're building a typical inpatient unit. Some of the considerations were the muted colors that we use on the unit, We have a bunch of skylights to have natural light come in, but it has to be filtered. So we don't have bright sunlight with shadows. We have quite a bit of sound deadening material up there, so we don't get the loud noises, the echoing. The floor has a pretty cool pattern on it, but again, the colors are muted. And then there's a pretty stringent safety factor that has to go into a unit like this.
So we also help support that effort during the pre-construction with estimating and material procurement. So we wanted to make sure that we provided the hospital and the architects with enough valuable information as it related to the availability of equipment and materials, and also the constructability, and then provide estimates and budgets so that we were able to work within the confines of the overall budget that the hospital had provided, and then ultimately meet their schedule.
And Tom, you said, I believe that you brought in someone from Florida to help develop these silent rooms, or that were part of the construction?
Correct. So there are quiet rooms throughout the facility, and it is a specialty type product and manufacturer. And they came in from Florida. And during our project through 2020, we went through the COVID-19 pandemic, right through the heart of it. And one of the interesting parts of that particular manufacturer was they came in from Florida, and we had to adhere to the very specific COVID-19 guidelines. So to kind of double back to what Jeff was saying, we had to make sure that we had that material secured. It was budgeted properly in the early stages of 2019, and then ultimately available for the installation and to be on schedule when we opened the building in 2020.
Yeah, so you were lucky with the supply chain issue. You guys had already thought about that before it became an even bigger issue across the country. And it's been open since October, correct?
That's correct. That's correct.
How did you manage, you just touched on this, but how did you manage to keep construction going during the pandemic? You touched on the fact that you luckily had the supplies ready, but obviously you have a lot of workers inside spaces and a contagious virus. How did you guys work around this?
Sure. So we always have a high emphasis on the safety of our workers, and then working in an occupied hospital and an unoccupied campus, we have a strong emphasis on the safety of the administration and the other patients. But as COVID-19 and the pandemic hit, we had to take a step back, and we had to rethink some of our policies and our procedures. So we implemented very specific COVID-19 procedures. Every trade contractor, including Downs as the controlling construction manager, had to update their safety policies, and everybody needed to have specific work requirements, and we had to adhere to the CDC requirements. In other words, we had to look at particular tasks where we were able to maintain safe distances to continue to work. And our industry and the healthcare industry, we were essential workers. So, as people were driving to work, there were billboards and things telling people to stay home. But, first and foremost, we needed to make sure that our workforce was comfortable and felt safe coming to work. And we were able to do that with the new policies and procedures. We did safety and wellness checks prior to the start of each workday. We also added hand wash stations, updated temporary toilets. So we took that to heart very much so, to keep everybody safe and working.
And Lynn or Jeff, how important was it that they did continue working? I mean, healthcare, again, a field where you couldn't stop either, to get this done, because it seems by this wait list and what you're saying that there is such a demand, any pause in this project could have been a little bit of a problem.
It was essential that we met those timeframes. A lot had to come together. Obviously, we hired staff, so we wanted to make sure that we were efficiently using staff. So we didn't want staff sitting around when a unit was not opened. But fortunately, Downs and Jeff's team really came through and delivered. Actually, the project was finished 6 weeks early. And all that meant is we were able to move in, and, within days, the other 2 beds were occupied, simply because we wanted to get used to the unit itself. So really a great success story, I would say.
Yeah, to finish early, given the circumstances, is pretty impressive. Were there any things you learned working through the pandemic that you now implement today? Are there some things that have stuck with you? Like I believe you mentioned the hand washing stations are more prevalent now.
Yeah, just like anything else, when you have to tackle something like this and you have to rethink some of the policies and procedures that you had implemented in your company, it is a good way to kind of fall back and look at what positive things we can bring out of having to deal with this. And the updated level of safetiness and cleanliness now will forever be part of our current safety plan. And it seems like it's relatively simple, it's inexpensive, but like you mentioned, adding temporary hand wash stations throughout the project and not taking that for granted, it's something that we'll be implementing throughout all our construction projects.
And what about you, Lynn? Is there anything that's being done differently? I'm sure there is, but that as you care for these kids who have special needs, they probably are, your staff's adjusting to a new way of caring for them.
Sure. So again, this unit is kids as young as 5 and goes up to 21. So most of the individuals on this unit are not able to be vaccinated. And so that, and they also are not comfortable wearing masks. These kids have, a lot of sensory disorders. So having something on their face, none of us like wearing masks, but we can push through and tolerate it. So, we've had to pivot in so many ways. Really critically was in the beginning when we had to stop visitation. So kids were coming into a hospital and their parents were not able to come and visit. Fortunately, we've been able to modify our visitation. It's still not back to what it was previously, but it's really essential that families are able to visit their children so that we can train them. And I think healthcare has forever changed as a result of the pandemic. I think we will never go back completely to the way we were. So it's become pretty ingrained in our day-to-day. I do hope to lose masks one day, though.
I was just going to comment on how we transitioned to the video meetings.
Yeah.
All of a sudden, the video meetings just exploded, and we found ways to meet and to communicate and to coordinate our projects quicker and more efficient. So in some cases, the Zoom meetings and the video meetings are going to stay as well.
I think when people think of construction, you think of men on the ground, right? You don't think of these Zoom meetings. Definitely something you would have had to adapt to. Well, what's next, guys? Are there any projects you're working on together or separately that are big and upcoming in the future you're looking forward to?
So I mentioned high demand, and just as we have come into the new unit and opened up both of the partial hospital classrooms, the demand remains. And so we have been granted permission by the state to expand, and we've added 8 additional beds. Then we will be renovating the unit that we left in order to meet the needs of 8 additional kids with autism. So our time frame for that is early fall sometime. Again, what has to come together is not only the construction side, but also the staffing. And these are unique staff with unique skill sets. So once we have safe staffing numbers, we will be able to relieve a little pressure on the ERs, which are experiencing really children's hospitals. There's a children's mental health crisis. And if we can take a few kids with autism out of the ERs to allow room for some other kids in need, I think we will be doing the community a great service.
Yeah, Tom, any upcoming projects you want to talk about?
Yeah, we have an exciting project that we're starting at the Stanford Hospital, LDRP and NICU. So we're very excited to start that. Actually was delayed about a year with COVID. So we're actually seeing a lot of things start to pick up. So we're excited about that job, and we're here to support the Hospital for Special Care and continue our partnership in their upcoming projects to help plan and coordinate their upcoming work as well.
And, we have time, so I want to touch on this. Staffing issues, has it changed a little bit for construction industry? I'm not sure. I feel like if you're a construction worker, you're usually a little bit more resilient anyway, right? You're out there in awful conditions some days. You're used to working through anything. Have you had trouble maintaining or getting more people to work on your team?
If we could take a step back in the beginning of COVID, when certain cities shut down, I know Boston had shut down a lot of work. We actually saw an influx of workforce that came to Connecticut. Actually, in some cases, helped keep projects moving as people were entering in and out of quarantine. And at this point, it's pretty steady. Right now, the materials and the supply chain is one of our biggest obstacles. And that could be driven from the number of employees that are working in the manufacturing and in the shipping and delivery business. So we are seeing some issues in the supply chain with plywood, some different types of metals, structural steel, and things of that nature. So the procurement end of our business, certainly we have a very heightened awareness of the lead times of material.
It's interesting you say that, because I just did speak with a manufacturing consultant for a different BizCast, and he was saying that manufacturers are having this skill gap and trouble hiring people, which again is not helping the supply chain issue. So right now it is trying to get into a better flow of being able to get you guys the supplies. On the other side of things, Lynn, you have seen a decrease, right, in medical staff, and it's more important than ever that you find these workers to come and work at your hospitals. I believe that's what you were saying when we spoke yesterday.
Sure. Yeah, healthcare recruitment has never been more challenging. I think COVID has caused people to rethink their careers and scared some folks off of the front line. And, Connecticut is always very competitive area. There are lots of hospitals and lots of healthcare systems. Fortunately, with autism, it's a very unique skill set. And we are a single provider, not, in the state. So we are a little better able to attract, but nursing and physician staffing is really very critical at this point for everybody in healthcare.
Well, thank you for listening to this week's CT BizCast. It was a pleasure to learn about this partnership, and hopefully we can follow up on some more projects you guys work together on in the future. You can listen and subscribe to our podcast on Apple or YouTube. And for more episodes, head over to CBIA.com.